CC14 Care Certificate, Infection Prevention and Control by the World of Work for Home Care Employees. AC 1.1 Causes of infection, ways infection enters the body and the chain of infection. Causes of infection. Infections are caused by harmful microorganisms called pathogens, such as bacteria, for example, Staphylococcus aureus, causing skin infections, viruses like the influenza virus or COVID-19 virus, fungi, such as Candida albicans, causing thrush, and parasites, for example, Giardia, causing stomach issues. Main ways infection enters the body. Respiratory tract, breathing in airborne droplets like flu or COVID-19. Gastrointestinal tract, consuming contaminated food or water, for instance, norovirus. Breaks in the skin cuts, wounds, injections such as MRSA infection. Mucous membranes, eyes, nose, mouth. Urinary tract catheter use can lead to urinary tract infections or UTIs. Chain of infection, infectious agent pathogen like bacteria or virus. Reservoir, where the pathogen lives, for example, human, animal or surfaces. Portal of exit, how it leaves the host, such as coughing, sneezing or blood. Mode of transmission, how it spreads like contact droplets or air. Portal of entry, how it enters a new host, for instance, mouth or broken skin. Susceptible host, someone at risk, such as elderly or immunocompromised individuals. Example: in a care home, if a staff member with a cold doesn't cover their mouth when coughing, the virus can spread via droplets to an elderly resident who breathes them in. AC 1.2 Standard IPC precautions and finding up-to-date information. Standard precautions: hand hygiene, washing hands before and after contact with individuals, use of PPE, gloves, aprons, masks, safe disposal of waste, using clinical waste bins, sharp safety, disposing of needles in sharps containers, cleaning and disinfection, regular cleaning of surfaces and equipment, respiratory hygiene, using tissues when sneezing, masks when needed. Sources of up-to-date IPC information: your organization's policies and procedures provided during induction or training. Public Health, England, also known as UKSA, NHS Infection Prevention Guidelines, CQC and HSE websites. World Health Organization or WHO. Example: during the COVID-19 pandemic, I checked my employer's intranet and the NHS website for updates on PPE usage and hand sanitizer guidelines. AC 1.3 Your role in preventing infection. My role includes following hand hygiene practices, wearing the correct PPE for each task, cleaning equipment before and after use, reporting any signs of infection in individuals, ensuring waste is disposed of correctly, and attending IPC training regularly. Example: I always wear gloves and an apron when assisting with personal care and dispose of them immediately after use, reducing cross-contamination risk. Occasions when hand hygiene should be carried out include before touching an individual, before performing a clean procedure like wound care, after exposure to bodily fluids such as toileting after touching an individual, and after touching an individual's surroundings. These are known as WHO's 5 moments for hand hygiene. Example: I wash my hands before preparing medication and again after helping a resident with their toileting needs. Demonstrate effective hand hygiene. Observation required. You must demonstrate. Wetting hands, applying soap, scrubbing palms, back of hands between fingers, nails, thumbs and wrists, rinsing and drying thoroughly, and of course using alcohol sanitizer when hands are not visibly soiled. Example: I was observed washing my hands for 20 seconds using the 7-step technique before and after assisting a resident with meals. AC 1.6, how your health and hygiene could pose a risk. Risks include coming to work when unwell, for example, with a cold or diarrhea could spread infection. Not being vaccinated, like missing the flu jab, increases risk to vulnerable individuals. Poor personal hygiene, such as having long nails or a dirty uniform and being exposed to infections at work and not reporting it. Example, when I developed a sore throat and fever, I reported this to my supervisor and stayed home, preventing possible spread to elderly residents. AC 1.7, common types of PPE and how or when to use them. PPE types: gloves when in contact with bodily fluids, aprons when providing personal care, masks during outbreaks or when working close to individuals, goggles or face shields, risk of splashes, uniforms, clean daily, not worn outside work. Example, I wore gloves and an apron while helping with dressing a wound, and I removed and disposed of them immediately after the task. Demonstrate effective use of PPE, donning, doffing and disposal. Observation required. Demonstrate putting on PPE in the correct order: apron, mask, gloves. Then remove safely. Gloves first, then the apron and the mask last. Dispose of everything in the clinical waste bin. Example, I was observed donning gloves and an apron before cleaning up a spill, and I disposed of them in a yellow bin afterwards. Alright, let's talk about appropriate methods for cleaning and decontamination. First, cleaning can be done using detergent and water. For disinfection, chemicals like bleach are used, and for sterilization, especially for medical tools, an autoclave is typically employed. Remember to follow color coding, for instance, red for bathrooms and blue for general areas. For example, I used a red mop and disinfectant to clean a bathroom floor, following our care home's color coding policy. Safe handling of blood and bodily fluid spills. Procedure: 1. Wear personal protective equipment such as gloves and an apron. 2. Use absorbent material, for example, paper towels. 3. Clean the area with a disinfectant like a chlorine solution. 4. Dispose of the waste in a clinical bin. Finally, wash your hands thoroughly. Example, I cleaned a urine spill in a resident's room using personal protective equipment and disinfectant spray, then safely disposed of the waste. Safe handling and disposal of soiled linen, equipment and clinical waste. For linen, use red bags. For soiled linen, handle with gloves and wash at high temperatures. For clinical waste, place sharps in sharps bins, incontinence products in yellow bags, and never overfill bins. Example, I placed soiled bed sheets into a red laundry bag, ensuring it was sealed properly, and disposed of used gloves in the yellow waste bin.